Hi, I'm Sophie Wilson. I'm a certified medical assistant, and today I'm going to teach you a skill that I learned when I was in Central Carolina in the medical assisting program, which is drawing blood. When you're drawing blood, you need to make sure that you realize that it is very, very important in the doctor's office, because when you draw blood, it's for diagnostic purposes. It's for testing the patients, making sure that their treatment plans are on track and they're doing exactly what they need to be doing. I'm going to go ahead and discuss that there are 3 different veins that I encountered when I was in my internship. The first vein that I encountered was you could lift their arm up, you wouldn't even put a tourniquet on it, and you could see the vein just bulging straight out, and you knew exactly where you were going to anchor down and get the blood. The second vein would sometimes appear the same way, but when you anchored it down, you could see it would kind of roll underneath the skin, and that's a little bit more of a harder stick, because whenever you are trying to get the needle in it, it can roll right underneath the needle and you'd miss the vein completely. And the third one I noticed when I was in my internship was a dehydrated vein. The dehydrated vein is when a patient comes into the doctor's office and they haven't had any fluid, so their veins have shrank much smaller than they needed to have been for you to be able to successfully stick the needle in and get blood out of it. I'm going to go ahead and discuss the equipment that you use when drawing blood. The first is the tourniquet, which is what you use to constrict the arm to stop the blood flow, and you always want to make sure you put it about an inch above the site. Some patients are a little bit more of a harder stick, and their veins are a little bit deeper and not as superficial as at the top of the skin, so you might need a blood pressure cuff to pump it up and make sure that the vein pops a little bit more, so you're not just digging around in a patient's arm, because that's uncomfortable. And then there's 2 different types of needles that I'm going to talk about. There's the butterfly needle, which you can see has the butterfly wings, and it's one of the smaller needles, and it's got a tubing system and would attach to a hub where you'd put the test tube in. These needles are great for pediatric patients and for patients that are fearful of needles to begin with, because it's a much smaller needle that you're approaching the patient with, and they'd be a lot more comfortable with a needle this big compared to a needle this big. Which brings us to the ETS system. The ETS system, you see, is just the needle goes directly into the hub. There's no tubing coming off of it, and the needle is much, much larger than the one on the butterfly system, so you would just be holding this hub right on the patient's arm with the needle in, pushing test tubes in and out. So that's why it's a little bit scarier for patients to have the ETS system as compared to the butterfly system. And the last thing you'll need are your test tubes. And of course, you're going to have to know the order of draw, the draw of which colors come first, because some of the test tubes have chemicals and stuff in them to help for other diagnostic purposes and stuff like that. So I'm going to go ahead and go through the steps of what you do to draw blood. First thing you're going to do is you're going to take the tourniquet, and like I said, you're going to put it an inch above the spot that you want to draw. And you want to do it on both arms, because if you do it just on one arm and you think you have a good vein and it ends up being a rolling vein when you could have checked the other arm, you could have seen that this arm had a great vein and it wasn't going to move, and it would just be locked in place when you anchor it down. And then once you find the vein you want to do, you put your gloves on and you clean the area. You would have your tubing system already set up, whichever you're going to use, and you anchor down the vein by pulling down. And at the same time, you take your other hand and you're pushing the needle in to their vein. While you're pushing the needle into the patient's vein, you want to be sure that they're showing no signs of pain, they're not flinching, they don't say ow or anything like that, because if they are, you need to make sure they're okay, and if they're not okay, you most certainly need to take that needle out, because you could cause nerve damage if you don't get it into a vein and you push it too far into the patient. When you're drawing blood with the butterfly system, you can see whenever you draw the blood, there will be a flash of red right here. So you're almost guaranteed to know if you're in the vein or if you're not in the vein. When you put the test tube in, you're going to get the blood. But with the ETS system, when you push it in, it's a little bit harder to tell, because it doesn't just have a flash of red. You just have to push the tube in and hope that you know exactly what you're doing, because if you don't know what you're doing, you can seriously harm a patient. Once you insert the test tubes, you draw all of the blood you need, and you should know what tests go with what color test tube, and you bandage the patient up, ask if they feel all right, make sure they don't need water or food, they're not lightheaded or dizzy, and you can let the patient go. You always want to make sure that the patient is comfortable. Like I said, different needles can make different comfort levels for different patients that have fears. You want to make sure that you do the tests right and that you aren't putting an ETS needle into a vein that is very, very small, because that means that you could blow the vein and hurt the patient, and they'd wake up with a big bruise the next morning. So you have to be very careful when drawing blood. I hope this was useful, and I hope that this helps you understand a little bit better how medical assistants draw blood in the doctor's office, and thank you for listening.